Hi, I'm Dr. Steve Weiner from the Aesthetic Clinique, and what we're going to demonstrate today we're very excited about is Voluma, which is the new Juvederm relative, which is thicker, more robust, and longer term. It's going to last for about 2 years, and it's FDA approved within the last month to be used in the upper cheeks. But as we do with all the fillers, we'll use it off-label in other areas as well. But we're very excited because we're one of the first to get a hold of Voluma to do this. So let me just show the camera. She has lots of volume, particularly strong in her upper cheek area. So this is the area of primary concern that we're going to help with the Voluma. And if we have time, we're also going to do her temples too. She also has a little bit of loss in the preauricular area. So we're going to do all this with cannulas so the bruising and swelling is minimized. What we're doing right here is we're cooling the skin down. We're not using topicals, we're just cooling the skin down. This goes very deep. And it goes very fast too, to give her anesthesia. So she won't feel this very much. The Voluma is also mixed with lidocaine. So here we go. We make a little entry for it with a needle, but then we put the needle away and all we use are plumb cannulas. So we're right here, and she'll feel a little bit, but she's going to get numb pretty soon. And so we're filling up her upper cheek here with the Voluma. And then we're going to go here to the zygomatic area. Okay, so there we go. That's one syringe. And you can already see a difference. We'll get out syringe number 2 here. And we're going to do some in this preauricular area now. So feel this a little bit. This fat pad is contiguous with the temple fat pad. So when you have loss of fat in the temples, you also get it here as well. So we're almost done over here. This patient's had a facelift, so there's a little bit of scarring over here. And there's additional fat loss because of the facelift in this area. So now we've corrected that area as well. And this is all done, notice, through the same incision hole. So now you can tell the difference here between the two sides. Very marked. We're going to do a little bit more on this side and then switch to the other side. I'm going to change cannulas and I'll be right back. Okay, this is part 2 of our Voluma volumization. We've done some in the cheek and zygomatic area as well as the preauricular. She needs some in this buccal area and a little more in the cheek. And so we'll again go through the same hole that we used earlier. And we're going to improve this cheek a little bit more. Now we're going to fill this buccal fat, which is right in here. Here we go. Need a little bit more. Right in here. Okay, so now we can compare the two sides. And you see there's a lot more fullness over on this side of the cheek area. She's lost the volume here and here, and we've refilled that in this area here and here. And we've also done the preauricular area, which is back here. So she's a lot more fuller on this side than she is on the other side. Let's just clean her up a little bit. And did you feel any of this very much?
Mm-mm.
Yeah. It's pretty comfortable. Pretty comfortable. So we'll take a break here and we'll show you when we're done how everything looks, okay? I'm Dr. Steve Weiner from the Aesthetic Clinic in Santa Rosa Beach, and this is part 3 of our volumization. We've already done the cheek, buccal area, and preauricular, and you can tell the big difference between the two sides. Now we're going to do the temple area here. I like to do a superficial injection. Other people do the depot injection. But with Juvederm, I think, which is very similar to Voluma, I like to do the superficial injection. So what you do is you do a little entry point, and then you use the blunt cannulas for the rest of this. This is diluted already, 1:1 with lidocaine. So. And then I'm underneath the vessels here, and I'm just injecting real superficially here. I'm almost done with this side actually. If you do it gently and you take your time, there's no bruising associated with this at all. Now we've, if you can see this side, it's hollowed out, and now this side is more rounded. And what you want to do is you want to round the upper face to make the upper face more rounded and to create what's called an inverted egg shape. So the upper face is more widened, the lower face is more narrow. And what this also does, if there is this loss of volume here, it helps lift the eyebrow and helps move skin away from the eye, so it opens up the eyes. So we're basically done on this side, and this side has yet to be filled. And you can see the marked difference here in this area here, in this area here, preauricular, and in the temples. So we'll go to the other side and then show you our final result. We're continuing on with the Voluma volumization of the upper cheek, lower cheek, and temples. We've already done both temples, the upper cheek, preauricular area, and lower cheek area. So we're going to do it on this side. You can see there's a big deficit right here. This has been her problem area. So we're doing it with blunt cannulas. And we make a small incision and then follow it up with the blunt cannulas. So here we go. So she'll feel a little bit of this, but it has lidocaine in it, so it becomes numb pretty quickly. So we're over here right now, filling this area. And now we're filling the lower cheek a little bit, mid cheek, I'm sorry. Now we're going to fill the zygomatic area, which is the lateral cheek area. Okay, so that's one. We're going to do 2 more on this side. So here we go again. And now we're going to do this lower cheek area. It's called the buccal fat area. So we're rounding out the face where the volume has been lost due to fat loss and muscle loss. It has lidocaine in it, so her expressions are going to be impaired for the next hour or so. Okay, so we're getting there. She still needs more volume here. And we'll cut out from here because we have to go get some more Voluma. Okay, so we're done with basically the Voluma facelift. I'm Dr. Steven Weiner from the Aesthetic Clinic. And what we've done is we've done 10 syringes. And we've improved the upper cheeks, the malar area here, the submalar area. We put some in the preauricular area, we put some in the marionette, we put some above the upper lip, we put some in the temples. And so we have 10 syringes in her, and there's not a bruise in sight. That's because we're using the blunt cannula technique. Now she has some superficial fine lines, and we can treat those with lasers or other fillers, but Voluma is not appropriate for those superficial fine lines. But you can see we volumized this deficit that we've had in all these areas with the Voluma. And this should give her about 2 years worth of improvement. So I'm sorry I got a little... But we did all these enhancements through 1, 2, 3 incisions on each side. They're not really incisions, they're more like ports with a needle. And see, she looks natural, she doesn't look overdone, but she looks a lot better than she did when she came in. So thank you very much. For more information, see my website at theclinique.net or my blog at stephenfweinermd.wordpress.com. Thank you. Ready? So our patient here is actually, I thought we had 10 syringes, but we did 12 syringes of...
Who is this person?
Voluma, and she wants to tell her little story right now.
It's the most amazing thing. I'm 64 years old. I've not looked like this since I was 35. It's magic. It's magic, and this is the magician.
And she's actually a bruiser, and
There's not a bruise anywhere.
there's not a bruise.
No.
Yeah, she's going to go out to lunch and dinner tonight, and she doesn't have to hide.
No.
Doesn't have to put, I don't even think ice is needed because
Yeah.
it's not going to help. It's just going to be a pain.
I thought it would be good. I didn't dream it would be fabulous. But this is fabulous.
Cool.
Fabulous.
And the only thing that we recommend is don't do any real physical activity today and sleep a little upright for the edema, but regular activities tomorrow, and that's really good. So
I'm going to spend the rest of the day looking in the mirror.